Share. Nucleic acid sampling room.
Hello. I want to check if I'm infected or not. Please help me do a nucleic acid test.
Okay, no problem. Open the package and take out the new swab. Use the swab to get a sample from the tonsils. Store the swab in the test tube. Use the alcohol spray to sanitize the test tube. Put the sanitized test tube in a sealed bag to prevent it from being contaminated by bacteria. Sample completed. You can send the sample to get tested. The test result is here. Everything is good.
Yeah, thank you so much.
Department of Stomatology.
Doctor, I have a toothache. Don't worry, I'll handle this. Put on the mouth gag and check the gums. The gums are a bit swollen and need antibiotic medicine. Antibiotic medicine can help the swollen places recover faster. Find out the teeth need treatment. There are small cavities on these two bad teeth and need to be fixed. First, clean out the black cavities. There is so much bacteria from the cavities. Hurry and clean it up. The nozzle can rinse the teeth as clean as possible. Put the fillings inside the cavities. The blue light from curing light can harden the fillings. All the cavities are fixed. Now polish the teeth so they won't be too sharp. cavities are fixed. Eat less sweets and rinse your mouth after meals so that your teeth will be strong and pretty. Thank you, doctor.
Department of Ophthalmology.
Doctor, there's something in my eyes. I don't feel good.
Let me see. There's still dust in the eyes. Let's rinse them off a bit more. Let's prepare the device for rinsing the eyes. Water can rinse off the dust in the eyes. Wipe dry the water on the eyes so the patient will feel better.
It's so magical. My eyes don't hurt anymore.
If there's anything dirty in your eyes, don't rub your eyes. Remember to go to hospital as soon as possible.
All right, thank you, doctor.
Department of Internal Medicine.
Hello, doctor. I feel uncomfortable.
Don't worry. I'll give you a checkup and start the treatment. Let's see what happened to the patient. This paste can help you recover from a swollen face. It's reddish and swollen. Must hurt. Hurry and spray the medicine on it. Let's do a checkup and find the problems. The patient has an upset tummy. Take some medicine first. There's a lot of bacteria inside the intestines. Let's defeat them with medicine.
I feel much better. Thank you, doctor.
This is my job. If you don't feel well, come to the hospital fast.
Okay.
Pharmacy.
Hello, can you help me pick up the medicine?
All right, please show your medical ID card. Reading the card now. Let's see which medicine the patient needs. Find the medicine the patient needs. Put the medicine inside the basket.
All packed. Here you go. Don't forget to take the medical ID card out. Medicine will drive away the pain and disease and keep you healthy.
Got it. Thank you. Yoo-hoo! Yoo-hoo!